Hi everyone and welcome to Alliance Live, a new online information and learning portal showcasing examples of innovative and integrated working taking place across Scotland within health and social care. We continue the series of these 30-minute webinars focusing on a draft framework for community health and social care integrated services. Our guests today from Scottish Government are Christina Naismith, Head of Integration Implementation in the Government's Community Health and Social Care Directorate, and David Rowlands, Professional Advisor for Integration. Christina led national work on development and support for strategic commissioning in the Joint Improvement Team and was a JIT lead for a number of health and social care partnerships. Christina has worked in a range of senior policy, planning and management posts in local authorities and in joint posts with the NHS. She also worked for the Social Work Inspection Agency and for the Care Inspectorate. David Rowlands was appointed as Head of Primary Care Development for NHS Ayrshire and Arran in March 2009, where he oversaw the modernisation of care to reduce variation, improve patient experience and enhance service quality. He was subsequently appointed as Head of Community Health and Social Care within North Ayrshire Health and Social Care Partnership in September 2014 and led the Pan-Ayrshire review of services for older people and those with complex care needs with a strong focus on developing community-based alternatives to traditional hospital-based care. Since March 2019, David has been seconded to Scottish Government as a professional advisor. Finally, as panellists deliver their presentations, we invite the audience to pose questions using the chat box, which can be found within the toolbar, just where I'm waving the mouse currently. These will make up the questions for the Q&A session, which will follow on from the presentation and bring our webinar to a close. So without further delay, passing it over to Christina and David.
Okay, good morning everyone. Really pleased to be here to talk to you about our work on developing the framework. I'm Christina Naismith.
Good morning everyone, I'm David Rowlands. Delighted you can join us this morning.
Great. Okay, to start off with, we're just going to give you a bit of background on the kind of context for this work, which is actually quite broad, and I'm sure you'll appreciate that. Starting with the work that we've been doing to review progress with integration, hopefully some people at least are aware that there was a huge amount of work undertaken last year, really culminating in a report that was published by the Ministerial Strategy Group for Health and Community Care in February of 2019, so earlier this year, to look at what we needed to do to up the pace and effectiveness of integration. Now, prior to this and during the review itself, there was a publication by Audit Scotland looking at progress within integration, and that was published in November of 2018. And it had a number of domains, 6 different domains, covering leadership development, financial planning, strategic planning, governance and accountability, sharing information and meaningful engagement. And under each of these 6 domains, we agreed that the review of integration that we were doing within government with our partners in COSBA and others, that we would use these 6 domains to outline the findings from the review. So the work that we've been doing to develop the framework was identified under sharing information. And the people who are familiar with our Cabinet Secretary, Ms. Freeman, she's very keen to see not just better sharing of information and data, which is a lot of the kind of work that you need to do in order to plan successfully the implementation of services and the delivery of better experiences and outcomes for people, that we also needed to be much better at sharing good practice across the country, and not just sharing that good practice, but implementing that good practice. So a lot of the work that you'll hear from David's description of what he's been doing to develop the framework is very much rooted in that notion that we needed to look at what's already working, what's working well, why is it working well, and how can other places begin to adopt that particular set of work. So across those 6 domains, we've covered a whole lot of different ground, and there's a lot of different work streams. There are 25 proposals that are in the report I referred to that cover each of these, and we can make that available through the links that are possible after this event, and make sure that everyone's familiar with where we're going. In addition to the work that we've done from the review of progress with integration, there's also clearly a whole range of extant policy that the framework and the work that we're doing on the progress with integration review that is based on extant policy. And that includes, I guess, majorly from my point of view, the Public Bodies Act that hopefully everyone is familiar with, that was published in, or at least enacted in 2014. There's also other very important acts around SDS, around carers, adult support and protection, children and young people, and adults with incapacity. And each of these is addressed to different extents throughout the Public Bodies Act, as well as other long-standing acts around the NHS and social work. And just moving on. We've also got a whole raft, never stand still in government or in local communities, of reform, modernisation and innovation. There's the Health and Social Care Delivery Plan that was first published in 2016, December of 2016. There was a new GMS contract introduced for GP services in 2018 that's largely based around encouraging and looking at how we can make sure that the GP becomes the local professional expert that people go to for certain things, but there's a much wider team available to provide mental health care, basically a whole range of people, including, I'm sure, some of the work that's been done by the Alliance itself around access to local community connectors and so forth. Achieving excellence is, again, I'm sure everyone's familiar with this, is the work that was done to improve people's education and looking to make sure that people have got basic skills and knowledge prior to leaving school. There's been a lot of work done around integrated workforce planning, and various policy documents have been produced around that, covering both healthcare, core healthcare activity, primary care, and also really, really importantly from our point of view, stuff around integrated workforce. There's been recently a Nursing 2030 vision also published, and there's also a huge amount of work going on in and around the reform of adult social care. So essentially, we've got a huge big piece of work that's to do with integration itself, but it's very much rooted in both national policy and within the reform work that's currently underway. But without further ado, I'd like to hand over now to David Rowland, who'll describe a bit about the specific work that he's been doing to develop and help us to work out what we need to do in terms of a framework.
Thank you, Christina. And I guess just to emphasise the point that Christina's made, for me, the framework for health and social care has to sit at the heart of all of that really important work that's already underway in terms of how we deliver integration, recognising the policy that's already in place and making sure that we have something that's flexible and dynamic enough to adapt to the reform and modernisation of services as we go forward. At its heart, as Christina said, the framework is very much about how we share good practice to enable local partnerships to identify good practice that's right for their area, to adapt it in a way that's right for their populations, and then to adopt it and draw the benefits that others have already realised from it. Quite conscious that for that to be effective, we need to be really clear and upfront with partnerships as to what we think effective integrated support and care actually looks like. And we've defined that within the framework as a series of characteristics, and they're on screen for you just now. So, to our mind, effective integrated care should be ensuring that people are fully supported to live well with their conditions and to self-manage those conditions wherever possible. Certainly, people should always be at the heart of setting their own priorities and goals, being clear about what their hopes and aspirations for the future are, and working with professionals to realise those as far as possible. And it's also about making sure that people are safe when they receive care, and they're supported in a way that's right for them, and that they have equality of opportunity in terms of how they access care and support going forward. Really, really important that professionals within an integrated system understand their roles and responsibilities in supporting people in that way, and that requires their personal development and professional development over time. It is, of course, about integration. It is, of course, about how we create fully functional, fully integrated multidisciplinary teams that are aligned to GP practices so that they work effectively together with wider primary care providers to make sure the needs of practice-based populations are fully met. And in doing so, realising that benefit that's identified within the 2018 GMS contract to release GP time to focus on those with the most complex needs and to ensure they become the clinical leaders and indeed case managers for those individuals. In doing all of that, we are really keen to see through integrated care a real focus on delivering care at home as the norm and offering a much wider range of services, support and interventions in doing so. But recognising that that requires really clear pathways to be developed between services, so the complexity and the ambiguity that we know can exist in services at a local level is removed and people get rapidly to the right person first time based on their needs. We also recognise that people's needs change over time and often change quickly, and it's really important that when they do experience any sort of deterioration at all, that they can access community-based urgent care services, again with that view to supporting people at home as a norm. And finally, again with that aspiration in mind, really keen to see the development of intermediate care. And what we mean by that is really short-term, targeted, highly focused interventions that can support people to remain at home when otherwise they'd head towards acute care, or indeed that they can be discharged more quickly from acute care to have the remainder of their hospital care plan delivered at home. So those are the characteristics that we would expect to see within effective integrated services. We're also really clear that to deliver that in the front line, there's a need to have a clear and consistent sense of purpose for our frontline practitioners across Scotland, as well as a sense of consistent expectation for those who engage with our services as well. And we've therefore built the framework for community health and social care services on a foundation of what we've called care. And what do we mean by that? Well, we mean that those practitioners will come together with people and their families to assess their assets, to assess their strengths, to listen to their hopes and aspirations for the future and set their goals with them, and then work with them to make sure the resources that are available to them are used to best effect to meet those goals and aspirations, and also to make sure that any requirement for statutory care is met in a way that's right for those individuals. It's also about adopting a care coordination approach to make sure, again, that people access the right professional at the right time based on their needs, and that families don't have to worry about what the next step in a person's journey is, that there will be someone there to hold the ring for that person's care and to coordinate it in a way that allows families to care and not care manage. It's also about responding positively and proactively, as I've already said, when people's needs change, and making sure that we avoid exacerbations or increasing levels of dependence whenever that's at all possible. And it's about empowering, encouraging and enabling people to express choice and definitely take control over their care planning into the future. Having looked at the evidence base that's out there and having listened very carefully to what's working well within local partnerships just now, we've identified what we've described as 12 high impact proposals, and the first 4 of those are on your screen, grouped under the heading of promoting healthy, independent living. And that is about how we adopt that assets, a strengths-based approach to assessment. It's about how we support people to manage their conditions effectively. It's about how we connect people with their communities to absolutely tackle social isolation, but also recognise the importance of communities of interest in terms of supporting people to manage their own conditions. And it's also about how we support people to live independently at home or in a homely setting through using existing or emergent technologies and through providing quick access to aids, adaptations and whatever supported accommodation they need. It's also about how we improve outcomes by working more effectively in terms of absolutely establishing those fully integrated community teams, to establish those teams that are definitely aligned to general practice, and those teams that work seamlessly with acute care, with the specialist services that acute care can offer, reaching out into the community to be part of that care planning and a specialist assessment that people need over time. And also recognising the importance of developing the skills and capacity and capability of our teams within care homes as well, to make sure they can provide more specialist care where it's necessary, and ensuring that our community teams are providing appropriate liaison there too. And the final grouping is around making the services more accessible. And it is most definitely about creating that single point of contact to take ambiguity and complexity out of the system in terms of how people access care and support. And it's also about how we develop our approach to care planning with that view to anticipatory care planning, not just in the sense of creating them, but how we use them effectively when people's needs change as well. And it is about that focus of how we support people to be as independent as they possibly can be through embedding re-enrolment across all of our services and adopting those intermediate care models that I spoke about earlier on. And we know that when this works, it works really, really well. And it works really well in the sense of improving outcomes for people and improving how the whole health and care system functions effectively. We know that key to that is having the right enablers in place and having them well established and having them matured within local systems. And what do we mean by that? Well, we mean there is absolutely a need across health, social care, across third and independent sectors and working with communities and carers to have that collaborative leadership that's necessary to set the clear vision, to share accountability for delivery, and to begin to take services forward in the right way. To have really well developed relationships across all care sectors and everyone involved in delivering care at a local level, and developing shared culture, shared values that can really underpin a strong team ethos, and to make sure all of the services that we offer are safe. And then when things don't go quite according to plan, that there's opportunities for learning and improvement through robust clinical and care governance arrangements. And we believe that when we have all of those factors lined up with the 12 high impact areas and a clear sense of purpose, we not only deliver on the characteristics of effective integrated care, but we deliver on the overarching aim of this framework, which is to spread good practice, to integrate care and improve outcomes, and in doing so, delivering the principles of integration and the national health and wellbeing outcomes. We're really, really keen to get your feedback on this framework. We're keen that we make it as robust and as useful as we possibly can. We're looking to get agreement on the document next month and then begin the really hard work about how we make it work in practice. So this is a great opportunity to share with us your immediate thinking around this. In particular, we're really keen to get your sense of whether or not that ethos of care is the right way to underpin everything we're trying to do. Whether we've captured effectively the characteristics of effective integrated care, and whether the high impact proposals that we're talking about, those 12 services in the middle, are the right ones to focus on in the first instance, understanding that they will develop over time. And equally, are those enabling factors the right factors to increase likelihood of success? So keen to open it up now to any questions or comments you've got, and just to help with that, I'll pop the framework itself back up on screen.
So thanks, Christina. Thanks, David. That brings us to the end of the presentation element of the webinar today. We can now move on to the Q&A portion. A selection of questions have been pulled from the chat box, and we're going to pose these to our guests now. Thanks again for coming, by the way. So, do you have any good examples of good practice that is emerging in terms of integration?
Yes. So I'll go first if that's okay, and then perhaps Christina can chip in. There's lots of good examples of practice out there, but one that I've been using through this engagement programme, and I use it a lot, is talking about Mary from Murray. And I keep saying that's not an easy thing to say, but Mary from Murray is a fantastic story. So Mary is a 72-year-old lady who lives in Murray. She had chronic knee pain for a long, long time. And had been consulting her GP about that, who had referred her to orthopaedics. Orthopaedics assessed her and said, definitely need an operation on the knee to relieve the pain, and referred her to the anaesthetist for her preoperative assessment. When she went for a preoperative assessment, the anaesthetist advised that unfortunately they weren't prepared to put Mary under anaesthetic because she posed a risk because her BMI was too high. And that she would have to lose some weight before she could undergo the procedure. Now, ordinarily, Mary would just have been sent back home and left her own devices to lose a bit of weight, but the anaesthetist and the surgeon put her in contact with Health Points in Murray, which is a combination of statutory care and voluntary sector working together to provide healthy lifestyle support and behaviour interventions. And Mary embarked on a programme of as active living as she could, given the limitations of her knee, and a new dietary plan as well. And 6 months later, Mary went back, having lost 3.5 stone, and the anaesthetist told her she was fit for surgery. But the orthopaedic surgeon told her actually she no longer required the surgery because her chronic knee pain had eased to such an extent that her mobility was back. So it was a great story for Mary in terms of that lifestyle change. It was a great story for Mary in terms of not having to undergo the risk of surgery. And it was a great story for the local health and care system in terms of avoiding an unnecessary intervention. And for me, it was done because the acute sector, the primary care sector, the third sector, and some community-based healthcare as well, had all integrated around the response to Mary's needs and found a different solution.
Can I just say something that's a bit more generic? And I guess that one of the things, when we were pulling together the review report on behalf of the MSG, which is the Ministerial Group I referred to earlier, that the Audit Scotland report, which had done a lot of different studies throughout Scotland, was basically very deeply reassuring, telling us very clearly that integration could work and it didn't require a change in the law, which some people have argued for, but that actually there were some very excellent examples of where integration was having exactly the impact that was required. One of the issues that we've got, though, is that we need to make Mary's story a kind of not an individual story, but actually a story of how people, wherever they live, wherever they are in Scotland, that's what happens, that's what people should be able to expect, and that's what we're trying to move to. Now that doesn't mean everybody gets the same service in exactly the same way, at exactly the same time of day, and delivered by exactly the same people doing exactly the same thing. It means that there's a consistency of approach, and I guess that route, what the framework is about, is trying to establish that kind of broad framework within which services can be delivered in the most integrated way that suits that local population, but that means that with it throughout Scotland there's lots of different Mary, John, Joe, Jeannie, whatever, Abdul, whatever, the whole thing is much more a kind of better experience and better outcomes for people. That's entirely what this is rooted in.
Thank you. So our next question is from David, and he's asking, what have been the main challenges in gathering this evidence?
So I don't know if challenges is the right word. I think some of the difficulties that people have in terms of sharing what's working really well is having the capacity and the time to actually do that. And that's one of the things that we need to think about in terms of delivering and implementing this framework, is how we create the dedicated space on a regular basis for integration authorities and others to come forward and share some of the fantastic work they're doing, and really importantly, some of the outcomes they're achieving through that. As part of the introduction, Nick described that my previous role was as head of service within North Ayrshire Health and Social Care Partnership, and there's no doubt that as you're doing the day job, it's a hard ask to take that step back, lift your head up and say, here's some work that I'm doing that's going really well, and these are the benefits it's having. But we need to find a way to create the opportunities for people to do that. So if you want to add to that, Christina.
I think that the main thing from my point of view is not always just to look at the best practice, which can be difficult to look at, but also to think about the learning points of when things haven't quite gone as people planned. And we need to continue to allow for that. It would be a very unfortunate world if we suddenly said this is the way to do it and this is the only way. That turns from a kind of looking at things to learn into dogma, and we don't want to go there. But we certainly, I think David's already said, we've basically set about trying to garner from each area the best examples of what they're doing, and that means every area is doing lots of really interesting and good things, but not every area is doing everything to the 100% across every piece of the framework. So everywhere's got something to learn and everywhere's got something to offer. And I guess that what we're trying to do is to facilitate that learning throughout the country and make sure people are learning from mistakes as well as learning from the good practice.
Thanks, Christina. So next up, Angela, I'd like to ask, how are we promoting this approach across mental health services, or community mental health services to be more precise?
So at this stage, we're very much focused on developing a framework that is generic and applies to all client groups. I think what Angela's referring to is one of the next steps towards implementation, and that will be about making folks who are involved in the delivery of community mental health services aware of this approach and this framework, but also beginning to collect some examples of good practice against each element of the framework that are particularly relevant to community mental health teams. Now already we have some examples pulled together from across some of the Lothians around integrated community teams and teams aligned to general practice that are very, very relevant to community mental health, but we need to broaden that story out. We need to broaden that range of examples out, and that's something we'll be looking to do over the autumn and winter period as we get ready for implementation and delivery.
Thank you. So next up, Michael would like to ask, what are the challenges in delivering this approach across the full system? That's including mental health services, addiction services, acute sector, as well as independent contractors such as community pharmacists, dentists and optometrists.
That's the next stage, and that I think David's already said that's the hard bit. I mean, in many ways, that's why we have to take this as a Scottish Government initiative, but we're working very closely with our partners, our delivery partners, and looking to embed the framework. The framework is just that. It can't, of itself, drive things without people buying into this is the way to do it. So a lot of the careful work that's already been undertaken is to take examples that are real, about real people doing real things that are having real impact. And as I've already alluded to, taking real examples of things that are maybe not having the desired impact that we would be looking for. So I don't underestimate the challenges, neither of us do, and I guess you wouldn't either. But I guess the only way to push forward and to look at what we do is to do it. And we're very clear that we'll be looking for people to do things differently, to cooperate and work together. And there's already, that's part of the providing good examples, because we know that where the best work has been done, the culture and ethos is in place, the good relationships are in place, everyone is included. There's a clarity about we're integrated and we're working as a team, but relating to lots of different services. And obviously the big thing here is about working with people, and to remember that this is all about people, and to be absolutely clear, we're doing this not for the better sake of services, but for people to get the kind of things that they need to help them move forward in their lives. And sometimes that means that they need a lot of help. Sometimes it means that they need just a little to make sure that things stay okay. So that's where we come from, and that's very much at the root of our kind of ethos, if you like.
Thank you. So the final question comes from Shona. She'd like to ask, has the framework been published in a draft format for consultation yet, and can it be shared with colleagues for feedback?
So it's not been formally published for consultation. What we're doing just now is engaging widely on the content of the framework and seeking feedback on that. There is a discussion paper that's available, and the Alliance have that, and I think I've made it available after sessions previously, so they can probably make it available again. We're working towards quite a tight deadline now, really keen to get that feedback in as quickly as possible, so that we can shape as much of that into the final framework as is possible. We've already had a huge amount of feedback, and it's been really positive thus far, and really helpful in terms of refining and developing our thinking. So anything that you can add to that would be grateful to see.
Thank you.
So that brings us to the end of the webinar. We'd like to offer our thanks to Christina and David for delivering their presentation and answering everyone's questions. We hope that it's provided some insight and takeaways to bring to your own organisations. Before we go, we'd like to draw your attention to some other new pieces of work taking place from the Alliance. The Integration Stories is sharing innovation and best practice in integration across Scotland. And we also have the Integration Network, which is available to join free of charge to anyone who's interested in learning more and helping to shape integration throughout Scotland, as well as helping to share best practice. You can also contact the integration team if you'd like to get your hands on the discussion paper along with anything else. Any further questions you have for Christine and David, we'd be happy to pass them along. So you can get in touch using any of the methods that are shown on the screen. Finally, a big thank you to everyone once again who registered for this webinar. We hope to have you join us for our next one on the 2nd of September, titled Discover Digital and How Technology Can Help Us Manage Our Wellbeing. Head over to the Alliance Live webpage or check on the Alliance's main Twitter to register for that. And in the meantime, don't forget to check out the Alliance Live podcast, which can be found on all major streaming platforms and on our website.